One of the reasons that I really enjoy doing adult reconstructive surgery is it's very gratifying, both for the patients and for me, because if you can think about it, somebody comes to me because they've got a chronic condition. I mean, it's not like somebody fell and broke something. I don't do fracture work. But their knees starting to interfere with their quality of life. Their hips starting to interfere with their quality of life. I've replaced 18-year-olds' joints. I've replaced 94-year-old patients' joints. So the bottom line is when people come to me, it's because their hip or knee is adversely affecting their quality of life. And they look in the mirror and they say, you know, if it wasn't for this hip or if it wasn't for this knee, my quality of life would be so much better. And so when they do come to you, and should they end up failing, which we can get into later, the non-operative types of treatments, and you end up with surgery, they are just so thankful. And I can't tell you how many times people have said, you've given me my life back. Well, if you put yourself in my shoes, that's a pretty powerful statement, and it makes you feel pretty darn good. You know, it's not like cutting somebody's leg off and saying, well, now you get to live, but you only got to live with one leg. Well, they're grateful to be living, but they're compromised. Whereas people that come to me say they couldn't go out and walk 2 or 3 blocks, and now they're back to walking 2 or 3 miles and exercising, going on hikes and doing the things that they were unable to do because of their bad hip or knee joint. So that really makes it all worthwhile.